Begin by introducing myself. I am Dr. Rekha Prabhu. I did my MBBS and MD in Physiology from the Manipal University, India. I am a lecturer in Physiology and the module coordinator of the cardiovascular system. The cardiovascular system module is designed as an integrated introduction to the diseases of the cardiovascular system. To begin the module, we introduce the anatomy and the physiological functions of the cardiovascular system. We also teach how to measure the vital parameters like the blood pressure, the heart sounds, the electrocardiogram, and other clinical skills. The lectures are integrated and we include the anatomy, physiology, pathophysiology, pathology, pharmacology and biochemistry. The students are taught about the pathophysiology of the common and the major diseases of the cardiovascular system, the biochemical and the pathological changes, the clinical presentations and principles of drug treatment in the cardiovascular diseases. The cardiovascular system module is of 5 weeks duration and it is held in the semester 2 of the phase 1 MBBS program. The various teaching learning methods are the didactic lectures, the seminars, problem-based learnings, clinical skills, laboratory sessions and small group discussions. We also include some tutorials. The information about the cardiovascular system module is provided in the module information booklet or MIB, which is made available to the students in the Taylor's Times portal. And the knowledge and the skills obtained in this module are applied in the other modules and throughout the clinical practice. So we expect that each of our students are aware about the knowledge and skills and how to approach a patient with cardiovascular disease.
Hi students, Biochemistry is back in cardiovascular system. This time I am back with metabolism of lipoproteins, the biochemical assemblies of lipids and proteins. What is good cholesterol, what is bad cholesterol, how does it affect your heart? You will learn a lot about lipid profile, a battery of tests that are done to find out your risk for cardiovascular disease, for stroke and for other health problems. So I hope you have fun studying biochemistry in the cardiovascular system.
Hi, welcome to the School of Medicine. I am Dr. Umesh here. I'll be teaching you the anatomy of the cardiovascular system. In this block we will be dealing with the gross and the microscopic aspect of the cardiovascular system. In the gross anatomy, we will be more concentrating on the interior and the exterior of the heart, as well as we will be looking at the blood vessels in the various major areas in the peripheries, that is in the limbs as well as in the abdomen and the thorax. And in the microscopical aspect of the cardiovascular system, we will be dealing mainly with the histology or the microanatomy of the cardiac wall, as well as the microanatomy of the blood vessels, that is the arteries and the veins. So see you back in the cardiovascular system. All the best.
Hi friends, good morning. Welcome to CVS module, and me with Dr. Rao will be coordinating for drugs in CVS. Now as you know, hypertension, myocardial infarction is a growing trend of these diseases in the world today, and you have drugs which can modify the disease processes and maybe help in curing some of them in medical sciences as of now. Now what we are supposed to learn in the CVS module are these drugs. So we will be having lectures on antihypertensive drugs, drugs for myocardial infarction, drugs for congestive heart failure. We will be also having lecture on drugs which help in lowering cholesterol, because that, as you know, is an important factor in contributing to myocardial infarction and related issues. So we will be also having a lecture on that. Now slightly away from this is something on anti-arrhythmic drugs. Now as you know, arrhythmia is an entity in which the mechanical as well as the electrical signals do not pass the same way as they are supposed to be, and which then hamper the functioning of the cardiac tissues and the cardiac function in general. And there are various types of arrhythmias, but then you have drugs which can cure and modify these pathological states, and slightly complicated. So what we are trying to do is we will try to have a CBL, that's case-based learning on anti-arrhythmic drugs. Now as goes with other systems, we will be also having a seminar on pharmacology, and that's towards the end of this module. So that's about drugs. So I welcome you all to e-learning in CVS module. I hope you learn, and I'll be able to give as much as I can along with Dr. Rao as far as drugs in CVS module is concerned. Thank you.